borrow my neighbor's agenda. And I'd like to call the meeting to order and welcome everyone. And do you want to take roll call?
Yes.
Is that necessary today? Yeah?
Yes, it is, and I will.
Go ahead.
All right. Dr. Jameson?
Present.
Valerie Clark?
Present.
Levon Lewis? Oh. I can see you. Can't hear you.
Present.
There we go. Okay. Angie Wilson?
Present.
Jonathan Johnson? Mic issues. Jonathan, I can see you. Can you say present into the mic for us? I'm sorry, we're having technical issues. I'm going to mark you as here. I can see you. Jose Melendrez, I believe, is joining us by phone. And I don't think he can chime in to say present right now. Dr. Cook?
Present.
That are identified on the minutes. It doesn't appear that everybody is identified there, unless I'm missing something. They only have 3 members present on the minutes.
I believe if you look below the Henderson, you'll see that the Carson City members were represented.
I'm sorry,
Oh, that's
not
okay.
reading well.
Very organized. We get it.
Very organized, yes. Sorry about that.
Thank you for, at
No.
least we can tell you read them. And everybody in favor of passing, please say aye.
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 Anyone opposed? And the minutes are passed. So now for the excitement of today. We have several new members over the last year on a review on the appropriate open meeting laws. And I remember when Dennis Belcourt gave me this in prior times, and he's excellent. So we'll let Dennis go ahead and give his presentation. Dennis, now, if people have any questions, would you prefer for them to raise their hand and interrupt as you go, or would you just wait till the end?
However, Dennis Belcourt for the record, Madam Chair, however you wish to proceed. I don't mind interruptions, but if you'd rather wait till the end, it's your choice.
I actually do prefer that as we go along, if there are questions while they're fresh in your mind, to go ahead and ask. If it turns out it's really making it go long, we can ask questions to be held till the end.
Very well,
Thank you, Dennis.
Shall I proceed then?
Please.
Dennis Belcourt, Deputy Attorney General, and I've, as Chair mentioned, I had the opportunity to present to her when she first started, and it was a one-to-one presentation, which I don't often do it that way. It's usually to a group. The open meeting law, just to it's obviously about open government, about transparency in government. I usually choose the penalties to discuss first and remedies, because those grab the interest. And probably the most frequent result of an actual violation is the action is void. If there's an action taken in violation, is void. It has no legal effect. There is a 60-day window for a court challenge to cause it to be voided, so it could conceivably be not void after 60 days. Never seen it actually get to that point. But that's the most common issue. But there are possible fines. There's even a criminal penalty of a misdemeanor. I just actually, coincidentally, this morning, our office open meeting law chief gave a presentation on this. So He mentioned today that there have actually been no misdemeanor prosecutions for open meeting law violations. I think it would be probably the extreme violation that would result in that, because it's obviously the extreme penalty. So that's kind of. I mean, you all have the slides in your book. There is an alternative of a do-over, which sometimes you don't know you've violated the open meeting law until afterwards, after a meeting occurs, and then you come back and do a new meeting to take care of that, and you can't do that. And when you do that, you have to notice it as a do-over. There's for corrective action special designation on your agenda when you do that. I had one agency that they didn't know that the item wasn't being properly posted, and it was, you feel embarrassed, you hate for that to happen, but we're human beings, and sometimes that happens. The board simply came back and went over those 4 agenda items, action items that were on their previous meeting, and redid them. And when you do that, it can't be just a perfunctory redoing. It has to be as though it's the first time, because you want to recreate the matter, for the benefit of the public who are wanting to hear what's going on. It has to be a debate, a real debate. You can't just, go through the motions, so to speak. So it only has a corrective action, only has prospective effect. In other words, if between the violation and the do-over, some things are done, those have no effect. And some things are done based on the action that was taken. Those actions don't affect. But once the do-over is done, it's done. The action is effective from then on. Some background on the open meeting law. It's found in NRS Chapter 241 for those who might be interested in looking it up on the internet or at your local law library, perhaps. But it's pretty easy to get on the internet, and it's pretty short. It's not that there may be there's a lot of detail in there, but it's something that I'm not a layperson, so I'm not sure how easy it is as a layperson to read, but it's a good thing to do perhaps. Also related to that, you have some judicial opinions. Matters concerning the open meeting law have made it to the Nevada Supreme Court, and so there is some interpretation of the law that is helpful to understanding the law itself. And you also have our office's open meeting law manual, which is also on our website. And we have opinions, open meeting law opinions that you can find on the website too. Those are basically people they usually concern a controversy. Somebody violated the open meeting law or was alleged to violate the open meeting law in our office. Got involved, an opinion was written, and it gets put on the internet. I've kind of got into a little bit about what happens with open meeting law complaints. I gave you a slide in there that details the number of them, and I've only had to write one response to an open meeting law complaint in my tenure of about 11 years with the office. So fortunately, I haven't had to delve too much into dealing with complaints. And that one was, fortunately, the agency was upheld. But they do happen, and they do result in some violations. And as we all know, perhaps you've been paying attention to the news with the Washoe County School District. They can be of serious consequence to. It did disrupt the board. I believe there's been a lot of changes since then, and since those several open meeting law complaints concerning the Washoe County School District Board. The intent behind the open meeting law, that's I guess slide 6, is to is that the legislative business be done in public. The legislature's determination that public bodies do business in public. It doesn't concern the legislature itself because they're not subject to the open meeting law, but they dictate that boards do business in public. There are exceptions, of course, we'll go into. On the next slide, I go into some of the facets of what constitutes. When is the open meeting law invoked? When does it come into place? Of course, it comes into place when there's a meeting of a public body. You have a quorum. The purpose is to deliberate or take action and take action. A public, I mean, clearly the exchange board is a public body, and you know, to make things absolutely clear, the legislature put in your statute that this body, the exchange board's subject to the open meeting law, so there's no question that it applies to this board. But of course, as those of you who've been observing or around the board for a number of years, at one point there were many subcommittees, it seemed, and they were meeting all the time. Those are also by the exchange board statute subject to the open meeting law, and they, even though they don't they just make recommendations in most instances, or they did do that when they were active, and they're nevertheless, it doesn't really matter that if you have authority to take action binding on somebody outside the board, it just matters that you are a public body, and they're deemed to be. And also you can have a like an ad hoc subcommittee that maybe you're not even knowing you're creating a subcommittee. I mean, the issue sometimes comes up, well, you know, the chair may say, I want so-and-so and so-and-so to look into this. Well, if they're doing it together, they're probably a subcommittee, and then they have to comply with the open meeting law. If the board delegates to one individual to take action, that doesn't create a subcommittee. And so that comes up often in the context of recruitment. I mean, recruitment of a director or officer of a public body. You want to get as many people involved, but you've got to avoid creating a subcommittee unless you want to have that subcommittee do everything in public. So some definitions of what constitutes, what are key terms in the open meeting law. The meeting is a gathering of members of
Excuse me?
Yes.
I just had a quick question on the
Sure.
subcommittees. I think, so in other words, even two people then would constitute a subcommittee
That's correct.
and require open law.
Open meeting law compliance would be required, yes. If they're chosen by the exchange board, yes, and there are two people who said, well, so-and-so and so-and-so. And I think even if designated by the chair in the meeting, that would, I certainly would want a consultation, recommend a consultation with me before you do any such action. But yes, that's it.
Thank you.
So a meeting is a gathering of members, and it can be by, as we know, by electronic communication. You also have have to have a quorum for there to be a violation, but you can have what's called a serial quorum or a walking quorum, where you have board or exchange business discussed among two board members who turn around and talk to two more. Then you have a quorum by serial communication, so that's to be avoided. Don't be, I mean, it's a specific intent violation, so you have to have done it with the specific intent to violate the law, but I wouldn't even, consider that, I would, if you're thinking about it, then you've probably got specific intent. So, about what happened at a board meeting wouldn't constitute deliberation, but so there wouldn't, in a social context, it wouldn't be a violation to do that. Of course, you can't act on anything in your social non-meeting. The next meeting is an attorney non-meeting, which to be distinguished from a social non-meeting, because maybe who wants to socialize with attorneys? Just a joke. But the attorney non-meeting is a gathering to receive information from the attorney related to to possible litigation. It's litigation concerning over which the board has some authority or some. So that was, of course, very important for this board a couple of years ago. We did have numerous non-meetings when there was a prospect of litigation, but it's been quiet, and we're happy with that now, right? But anyway, you can deliberate in a non-meeting with the attorney about the matter, and that typically, when you're involved in litigation, there's all phases of litigation: filing the complaint or answering the complaint, doing discovery, settlement discussions. Any one of those could conceivably be a point of discussion for a board, and it's sometimes you can't act, so you can't really get board approval except going to a public meeting. So when you're talking about settlements, it's always a little bit how do you get input from the board without acting? So that's an area where non-meeting is critical, of course, because usually you don't discuss settlement issues in public. Kind of undermines the process. So moving on to kind of one aspect of the non-meetings, of course, is you don't have to follow any part of the open meeting law. You don't have to record the meetings. I mean, I have some slides later where we discuss that, but when you're as we know, we have to audio record or transcribe board meetings, and we also have to take minutes and have, obviously a public comment, but a non-meeting, you don't have to have any of that. So the other exceptions to open meeting law, you have non-meetings, and then you have what you'd call closed meetings. There's some other exceptions that are found in the open meeting law, and then of course there's you can possibly find exceptions elsewhere. I think, in fact, at this discussion this morning, the attorney was mentioning by regulation a public body exempted. It was setting up these I think in the Clark County School District reorganization, they set up these sub-entities, and those were by regulation exempted from the open meeting law. But if you're accepted, if you're accepted from the open meeting law as a closed meeting, you're only accepted to the extent, or for that matter as a non-meeting, only the extent provided in statute. To any extent not specified in statute, you have to do an open meeting law, open meeting to conduct that aspect of it. So, just as I mentioned with the attorney, if you want to get the settlement approved, or you want to get a decision approved by the board, a vote of the board on that litigation, you still have to go to an open meeting to do that. Or usually, the final settlement is what gets approved by the board in an open meeting law, because that's where you're deciding, to send a matter on for whatever resolution it needs to go from the board. Closed meetings. Let's see. A public body. There's some items that are allowed to be closed, and others that are specifically not allowed to be closed. An example would be, you can close a meeting for say if your statute provides, or under the general statute, for a personnel matter, to the extent, for example, you're considering individual characteristics of the person, their mental health, or their capability, competency. You can have a closed meeting for that. There's the specific statutes that set forth when you have a closed meeting, and then others, for example, as this board well knows, when you're picking your executive director, that has to be all done in open meeting. You can't close any of that, so that's by statute. Moving on to agendas, there's one issue that the board members here may or may not be privy to all the processes of drawing up an agenda. Just as kind of background, typically I get to see an agenda typically before it goes to or at the same time it goes to the chair, and we look it over. I look it over from the standpoint, is it clear and complete from and does it have all the components that are set forth in the law for an agenda? It has to have, and is it being noticed in a timely fashion? Those are the kinds of things I look. I'm just looking for open meeting law compliance. It's not always clear from the agenda whether it's clear and complete. Sometimes, ideally, you'd want to have the supporting materials but we don't always have that. We don't have that luxury. So sometimes it's a matter of discussing with the agency, well, what's going on here to make sure that the agenda is clear and complete. So most of the language most of the requirements of the agenda are in one section of the open meeting law, and I frankly I can't read it on my little slide.
Could I interrupt one moment?
Oh, sure.
I did understand, and I'm not sure because I didn't hear it in roll call, that our other board member, Jose Melendres, is actually on the call, but he called in on a line which is listen only, so he couldn't check in. I was wondering, is there actually a line in which he's able to call in and speak up if he wants to or ask questions?
Yes, there is, and we are about to connect it. We didn't want to interrupt because it will cause a mic issue real quick. So he
okay.
he's
Then at
notified
the
me that
end-
he's listening in right now, and
Yes.
that we could
So
potentially.
we have him added to roll call, and then when we're done,
Yes.
we can ask him if he has questions.
Yes.
Thank you.
The PPO company reduced its QHP plan offerings from 15 down to 9. Now, what's important to point out, and for anyone who may be listening that is actually on a exchange PPO plan in Southern Nevada, because Anthem, the PPO company, is not coming back on exchange in Southern Nevada, there are about 11,000 policyholders that if they do not choose a plan themselves, by the end of this month, as Heather talked about the auto re-enrollment that's going on, CMS is going to move the people who haven't already chosen a plan with another carrier. CMS is going to move those people to either Health Plan of Nevada or the other Anthem company, both those companies being HMOs, because there's no PPO option available. They're going to be moved, auto-enrolled in an HMO company. It depends on the meta level. As is indicated on the slide, if you're on a gold or bronze Anthem PPO exchange plan in Southern Nevada, you're going to be moved to Health Plan of Nevada. And those consumers are going to find out towards the end of this month or early December from CMS. Silver catastrophic policyholders will be moved to the HMO Colorado company. As indicated earlier, the QHPs from Anthem are available in all counties outside of Clark and Nye, but Anthem off of the exchange is no longer going to be marketing any PPO plans for 2017. So a consumer that's interested in an Anthem PPO plan off of the exchange isn't going to see one on any website that's actively marketed. The Division of Insurance does display those plans on its website, and it clearly indicates that they are not actively marketed. Another very important thing for people I wanted to just, because some people may be sitting on plans off exchange with Anthem, so I wanted to use this opportunity to try to get this message out to them. If they don't already know, anyone that's on an off exchange Anthem PPO plan, when they do get renewed for 2017, will no longer have any doctors out of the state of Nevada in network or any coverage out of network out of the state of Nevada unless it's an emergency. So that is a big change that those policyholders hopefully will understand during open enrollment, so they can make decisions whether that's okay for them or they want to go to another plan. The commissioner approved about a 14% increase for the Anthem PPO company effective January 1st. The Anthem HMO company, which is statewide on and off of the exchange, and currently, well, not currently, but as of the end of the first quarter, reported 7,284 QHP members. They reduced the plan offerings from 17 to 12, from 16 to 17. And it's something that's important to point out, and it's confusing to some consumers. I have heard from some members of the exchange staff that have gotten phone calls on this, and Anthem's only gold plan, and all carriers on exchange must have at least one gold plan, but Anthem's gold HMO plan is through the Office of Personnel Management. So that is that office, and OPM also administers the federal employee health plans. We don't have much involvement in terms of the exchange doesn't have any involvement in certifying those plans. Those OPM plans are certified by OPM. They're displayed a little differently on healthcare.gov, so consumers may not immediately recognize those as Anthem, but they really are identical to the other Anthem plans. The only difference is regarding external review. If a consumer appeals and wants to exercise external review, those OPM policyholders go to OPM instead of our state agency, GovCha, to exercise their external appeal rights. The commissioner approved an increase just under 9% for the Anthem HMO company effective January 1st. Health Plan of Nevada has the largest share of QHP members in the state, reported 45,358 as of 3/31. HPN did reduce its plan offerings from 16 to 10, has eliminated platinum plans, which means that there are now no platinum plans available on or off exchange from any carrier in Nevada for 2017. So consumers shopping won't find those. And also consumers shopping won't find gold plans off of the exchange. So gold is only available, actively marketed on exchange only by carriers. As I indicated earlier, HPN offers QHPs in Clark, Nye, and Washoe counties, not Carson, not in rural Nevada. Policyholders are going to get about an 8% increase effective January 1st. And I added some off-exchange information because HPN's sister company, Sierra Health and Life, has the largest market share off of the exchange currently, and there's some significant change there. Consumers in Nevada that are shopping won't find Sierra plans anymore. They are not actively marketing those plans. They're displayed on our website, but they won't see them on a broker portal or any other place to buy it. They're not actively marketed. The 33,000 members that are renewed for 2017 on these Sierra plans will not have any network providers out of the state of Nevada. That change is a little different from Anthem. There is out-of-state, out-of-network coverage for these people that renew, but there are no in-network providers outside the state of Nevada for these 33,000. The fourth carrier on exchange is Prominence. Just about 11,000 members statewide. They're not in rural Nevada. They are in Carson, Washoe, the neighboring service area, 3 counties neighboring to Carson, and also down in southern Nevada. They are reducing their southern Nevada plans down to 4. And those 4 plans only have the Healthcare Partners Network. So any policyholders that currently down in southern Nevada that have the other network plans, they are going to be moved over to a Healthcare Partners Network plan if they don't take any other action during open enrollment. The commissioner approved a 17% increase for Prominence effective January 1st. In Prominence, and they've been on the exchange since 2014, but Prominence has never actively marketed individual plans off of the exchange. And that is the end of my presentation, and I'd be happy to answer any questions anyone has. Thank you.
I would first like to thank you. That was an excellent report, an incredible amount of information in such an organized and easily understood presentation. I didn't think I was going to really be able to understand all that, and your really big slides helped.
Thank you.
I want to ask if there's anybody, particularly some of our brokers who might, Valerie, some of the others who area of interest, have any questions.
Madam Chair, Valerie Clark for the record. Thanks for that. That was actually very helpful for me. I sort of know most of this in my head, but I wasn't clear on all of it. So that was very helpful. Thanks, Glenn. When the carriers decide to pare their plans down or exit the marketplace, are they interviewed for the rationale of doing so? Are we getting clear understanding? I mean, I can make an educated guess, but is there a formal process for interviewing the carriers to get information about their experience on or off the exchange, and why they may be coming on or exiting the marketplace?
Would you like me to address that? Okay, thank you. Thank you for the question. And there, I wouldn't say it's a formal process, but we certainly are in close communication. Anytime any changes are made, especially significant changes like this, carriers do openly communicate for reasons that are probably fairly obvious, that they want us as the regulatory agency to understand what is happening out in the marketplace, and we also are an agency that does get information out to the public and other stakeholders. Carriers have a number of decisions that they can make. One of the decisions to not actively market is something that carriers have been doing since 2014. So there's not as much communication with that decision, but we do have a pretty good understanding when those carriers make that decision, because the Division of Insurance website, we did launch a market-wide rate wizard that shows all of the plans and prices and plan documents and links to provider networks and formularies. And because we maintain that, it needs to be accurate and reflect what carriers are presently doing and what they're going to be doing in the future. If a carrier actually decides to exit the market, then that's when we have a formal process. And if a carrier wants to completely exit, for instance, Time Insurance Company took that step nationwide, there's a statutory obligation to submit a letter to the commissioner 60 days prior to notifying policyholders 180 days in advance. So it's about an 8-month process, and in that letter, carriers are required to explain why they are making the decision to exit. Now, carriers, under the rules of the ACA with uniform modification, carriers can make a lot of changes from year to year, and then they can decide, after we approve plans, all plans, including exchange plans, are approved by the Division of Insurance. We work closely with the exchange on those exchange plans. After we approve rates and forms, then it goes over to the exchange. The exchange actually certifies. Because the exchange utilizes the federal platform, carriers actually have to execute an agreement and sign off on plans with the FFM, with CMS, so they can actually make decisions at every point. Even after the exchange certifies, they can decide to stop. So there's a lot of activity that happens.
Well, and I understand that. I think I'm thinking of it from the perspective of trying to be proactive in maintaining carriers in the state, whether they're on or off the exchange, preferably both. But I mean, I'm just curious. My educated guess would tell me it has to do with loss ratios being high, demographic, maybe possibly demographic issues, or other, when we're evaluating large group renewals we can't really do it for small group anymore, but for large group, we can find out a lot of information about why a number is a number. And I assume you get that information if you're going to be approving rates and things like that. But I think the general public, consumers, could definitely benefit from some pared down information as to why things are the way they are. Informally, I've been told by carriers that they're taking big losses, but why are they taking big losses? Why are the losses big? What's the problem? What can we do as an exchange board, as a division of insurance, or as a state? What can we do to make carriers want to come back? Because it's very obvious where we're going with this. And I think the question has to be asked, do we want to have carriers here and have this exchange be as vibrant as possible, or do we want to let things kind of fizzle out? I highly doubt anyone wants to let things fizzle out, but I feel like there could be some proactive activity in partnering with the carriers more to become a more attractive state to do business in. And possibly that might have to do with also how things are handled at the federal level with, the FFM. I'm a big proponent of getting statewide, restoring our state-based exchange as opposed to using FFM, because I feel we could get much more data out of it. But I don't know. I feel like there's got to be kind of this point in time when, and I don't know who takes the ball and runs with it, whether it's you or the exchange or maybe a collective group of people, but somebody has to decide if we want to be an attractive state for these carriers to do business in or not. And if we do, what do we have to do to make them want to come back? Because I have a feeling that they would want to come back if things were attractive to them,
Valerie, thank you so much. Those are very good comments. And I think that our new Exchange Advisory Committee is going to address a lot of those questions that you asked. And hopefully we will get the feedback, because I think it's all of our hope that indeed we can keep this very vibrant and have an increasing and not decreasing numbers of participants with our carriers, and have them offer as broad a number of plans as possible. And I think that's one thing we are going to see with our Exchange Advisory Committee. And I really thank you for all those questions and comments. They're excellent.
Thank you.
And
Sorry to be so wordy.
And I want to thank so much that presentation, as you pointed out as well. It was excellent, and I think it was very enlightening for many people. The next item on our agenda is the discussion and possible action regarding dates, times, and agenda items in the future. And I would just like to say, I would like to have Heather, as information comes in, to give us a regular update on the ACA nationally, how it affects us locally, actions that Congress might be taking, and also, Valerie, as a follow-up to what you've said, when the Exchange Advisory Committee starts meeting, to give us some follow-up and updates on those meetings. Did anybody else have any other things they'd like to add?
Madam Chair, I would just like to add that we include in our publicity the fact that the Affordable Care Act is still here, because there may be some people who think that it's gone away simply with the election that has just taken place. So I hope that we will make sure, and I haven't looked at this completely, but I would hope that we would just make sure that folks are aware that, the law has not changed.
Madam Chair.
Excellent point.
If I could, I just wanted to chime in on that and just thank you, Vaughn, for that point. And that is something that we are adding to our talking points. And in about an hour, Janelle and I will be talking to a radio show, and we'll make sure to hit on that topic.
Can I just add, Angie Wilson, for the record, that it's pretty amazing looking at the report that you gave to look at the number of Nevadans that are uninsured has significantly gone down. That's really remarkable. And even though I don't know what the percentage was for 2016, but in 15 we were down to 12, just around 12%, with another 20,000, 22,000 people on the exchange or now covered. That is really, really remarkable. I mean, to look at this from a statewide perspective and the impact that that has not only on the exchange, but even with Medicaid and how much our partners at Medicaid have had to, really expand the care. But it's something that, I feel really proud of. I know, all the work that's gone into that. So pretty remarkable.
Yes, excellent point, and especially with the Medicaid expansion, as you stated. At this point, if there's any public comment up north, we'd like them to come forward. Is there any public comment down
Yes,
here
there is.
in
There
the
is.
south?
Oh, there's public comment here in the north.
Oh, okay. We have none down here, so why don't you go ahead and proceed? We can hear.
How's that? My name's Susan Hogue, and I'm from Reno. And I came down today specifically to make sure that the AC wasn't going away for 2017, because I'm self-employed. I've always had health insurance, but I had to buy it myself. And so I am very grateful to be able to, for myself and my 2 daughters, to buy insurance through the exchange. So keep it up. That's all I want to say. Okay. Thank you.
Thank you so much for your testimony. All of us on the board and the staff really appreciate those comments. And we want you to know we're going to continue working hard to make this a better exchange, better than ever the next year, and continue optimistically that we'll be able to be here to serve people such as yourself and many other Nevadans and get that uninsured rate down as close to zero as we can. I want to thank everybody today for this excellent meeting, so informative. And again, once again, welcome, Ryan. Have a wonderful afternoon.